Hello, and welcome to the third and final video for medical report writing, the medical necessity letter. Please pull out your PowerPoints and turn to the page where we begin the discussion on the medical necessity letter and follow along with me right here. First question I have for you, medical necessity letter versus a referral out letter. What's the difference? In some cases, they seem very similar. The components will be the same. You might want to look at it like this. When you are going to craft a medical necessity letter, you are still the full physician, or the patient for whom you are referring is under your care. You are simply sending them out for a procedure, a test, or something like that. With the medical necessity letter, you have identified something that this patient needs and you're asking for it. In a referral out letter, you're referring that patient over to somebody else's care. You're saying, hey, either temporarily or permanently, the patient is now under your care. That's kind of how I see the difference. For this course, we're asking you to create a medical necessity letter. Again, the components will be the same for the two letters, but we're going to focus more on a situation where the patient is still within your care and you want to send them out to an expert or specialist for something, a test, some lab work, or maybe even to have somebody diagnose them or look at something. So there's a lot of applications for this, but more importantly, we want you to know how to craft a letter and be able to communicate exactly what you want. So follow along and let's look at what components are necessary, pun intended, in a medical necessity letter. You need to have the patient reference, the patient's name, if there's a claim number, whatever you've been using in your comprehensive medical report or even your progress report, make sure you use those same references. Then, and you can see I'm very passionate about this because I've bolded it for you, state what you are asking for in the first two sentences. I have seen so many medical necessity letters that are paragraphs and paragraphs, and then finally the person asks what they want. Let me ask you this. Are you a busy person? I bet you are. And so if somebody sent you a letter and you had to read 3-4 paragraphs before you can even get to what they want, are you going to read that far, or are you going to say, I don't have time for this? Exactly. So anybody that you're asking something from, have that respect of their time as well. Be very clear in the first two sentences. Why are you writing the letter? What do you want? So we'll look at some examples of how to do that. We've provided you with a sample of that as well. I just want to stress the importance of getting right to the point because everybody in today, especially in healthcare, they're very busy. So they want to know what you want right away. You need to have an HPI with objective outcomes compared to the prior success evidence. So for example, you would say to them, a brief HPI in your medical necessity letter. I've been treating this patient for 5 weeks, giving them acupuncture once a week for 5 weeks. Usually I would see results by now, but I'm not seeing the results I normally see. In fact, I'm including in this letter some current research that provides evidence that acupuncture is effective after 5 treatments, and this patient hasn't had any improvement. So I'm asking that you perform an MRI, or if it's something else, some blood work or lab work. So that's what I mean when I say to have the HPI, the history of the presenting illness, just kind of summarized for this healthcare practitioner with your objective outcomes. They came in with 9 out of 10 and they still are at 9 out of 10. They came in with the specific limited range of motion, they're still there. Or if you're using medications to measure your outcomes, they came in taking 800 milligrams of ibuprofen 4 times a day and they still are. And normally I would see better results. So you have to make sure right after you tell them what they want, what you want. Hi, I'm Dr. East Harridan Phillips. I've been treating Mr. Patient for the last 5 weeks for abdominal pain, for shoulder pain, and we are not getting the results I would normally see. I'm asking that he comes to you to get an MRI, or I'm asking you to perform an MRI. I'm asking you to perform some blood work, that sort of thing. In the first 2 sentences, my reader knows what I want. If there's relevant research, that's nice to add into this letter as well, like I referenced just a few moments ago when I said, normally I would see better outcomes than this. Normally, I would see progress by this patient. In fact, research has shown 5 acupuncture treatments usually results in improved range of motion or lessened pain. So if you have research, put it in your letter, attach the abstract or attach the link to where they can read further. And then I write here, you follow up with them. Don't expect them to follow up with you. So in your letter, when you're in your closing, you can write something like, thank you so much for your attention to this matter. I will be following up with you in the next couple weeks to find out the results of the test. Or please have your office fax the results here. I don't know if anybody has faxes anymore, email, what have you, but you follow up with them. How would you like it if somebody sent you a letter asking you to do even more? No, you wouldn't. So to completely co-manage this patient's care, it's best if in your letter, you state what you want in the first 2 sentences. You give a little bit of background of the patient and why you're asking for what you're asking. Any research if you have it, and then you let them know, I will be following up with you in the next couple weeks to get the results or even talk about this. And you can say, definitely, if you'd like to speak to me about this patient, feel free to contact me and the number given in letterhead or my cell phone here, my phone office number here. But again, I put in stress terms again, you follow up with them. Don't write anything like, please call me, or you do this or you do that, because they probably won't. The likelihood is they won't. We have provided you with a sample of a well-written medical necessity letter. You should have that with you. Take a look at that. I think at this point, you have everything you need to create this piece and for the assignment. These major components are the same for a referral out letter. Again, in a referral out letter, you tell them right away why you're referring them out and let them know that you'll follow up, or make sure it's very clear who is the primary care physician for this patient. If you're referring them out completely, make it clear in your letter. Or if you're referring them out momentarily, let them know you'll follow up so you can co-manage the care. The important thing between these 2 letters, and especially with the medical necessity letter, is just be clear, be concise, be professional. Let's finish up the PowerPoints and get you out of this course. The 3 assignments do, in summary, the comprehensive medical report, the progress report, and a medical necessity letter. If you're going to use real patients, of course, because of HIPAA, please use fake names. And please submit all these documents and you will receive a credit for the course. I believe we've provided you with a grading rubric so you can kind of see how you'd be graded. And again, samples of each of these documents are provided to you as well. I want to wish you much success in your future. I hope our paths cross. If they do, let me know that you saw this video, and I will see you soon, hopefully. Goodbye.